And for our viewers, we're just getting ready for our track 3, almost ready here. Okay. Hello, everyone. This is Katie Phillips from Tosa Together. Welcome to Tosa Talks, Building a Diverse, Thriving Community, an ongoing Facebook Live series proudly sponsored by our generous friends at Bostic. Tosa Talks features 3 monthly presentations designed to provide opportunities for meaningful discussions around racial and social justice issues to support the work of building an inclusive, anti-racist community. We are excited to welcome the Wauwatosa Health Department for tonight's Tosa Talks presentation, addressing issues of race in public health. This live discussion is part of the government and organization track that streams live at 7 p.m. on the last Thursday of each month. Please also join us for the personal stories track on the second Tuesday of each month and the equity and inclusion track every third Wednesday. Presentations are recorded and available for viewing and sharing on this Facebook page or on the Tosa Together YouTube channel. We welcome and encourage you to take part in the live Q&A session tonight. Please add your questions for our speaker into the Facebook comment section during the presentation. Now it is my pleasure to introduce your host, Catherine Reeby.
Hello, good evening, everyone. My name is Catherine Reeby, and it is my pleasure to welcome Laura Stevens, Public Health Manager from the Wauwatosa Health Department, to Tosa Talks. Tonight's presentation will focus on addressing issues of race in the public health system. Laura Stevens brings over a decade of public health work to her service as the City of Wauwatosa's Public Health Manager. She has a Bachelor in International Healthcare from Marquette University and a master's degree in public health with a focus on community and behavioral health promotion from UW-Milwaukee. Laura's wide range of experience ranges from direct client education around substance abuse and STI prevention to conducting research on health impact assessments and policies. In addition to overseeing the Tosa Health Department's environmental health and emergency preparedness programs, Laura also leads 2 community coalitions on substance abuse and mental health. Laura works with the health department team to develop local health intervention plans, promote health equity, and research and create innovative community health strategies. Please join me in welcoming Laura Stevens of the Wauwatosa Health Department to Tosa Talks.
Thank you, Catherine. Okay, I am going to share my screen with you all. Okay, are you able to see that? Sounds good. Okay, so I'm going to talk a little bit about what equity means for us here in the health department. And a lot of that has to do with health equity. So health equity is pretty foundational to public health. We've been engaging in this work for many years by promoting it in many ways. Health equity basically means that everyone has a fair opportunity to be healthy. And it's hard to be healthy if you don't have access to stable income, safe home, healthy food, good education. While health can be dependent on many of our individual choices, we can only make choices based on what options are available to us. So working toward health equity means ensuring that everyone has the access and opportunity to make the best healthy choices for themselves. In Wauwatosa, in our county, state, nation, there are a lot of social and systemic forces that cause health disparities. These disparities are basically differences in health outcomes based on race, ethnicity, sex, age, socioeconomic status, and so on. Improving health equity requires us to address these disparities and remove the obstacles that cause them. So at the health department, we work toward health equity by improving access to health resources for the entire community. One of the things we did recently was developed a health equity mission statement. I won't read the whole thing. It pretty much sums up what I just talked about, but it is available on our website if anyone wants to read it in full. So it can be sometimes hard for people to understand how health is impacted by social or systemic factors. Many people think of health as access to a doctor, healthcare services, or insurance. We see it as a little bit more broad. Anything that prevents you from being your healthiest self is part of public health. So this picture illustrates inequities in health. In order to be healthy, we all have to make certain choices or take a certain path to be healthy. That could be healthy eating, exercising, going to a doctor. For some people, like in that top part of the picture, it's really easy to make those healthy choices. There's no barriers to that. But for other people, they might have a few barriers. For example, if there's no grocery stores in their neighborhood, it could be hard for them to get access to healthy foods. Or if there's a lot of violence in their neighborhood, they might not be able to go outside to go on a run or go for a bike ride. So that just means there's more barriers on their path to being healthy. It's not as easier for them to make those healthy choices. And then the bottom part of the picture shows that some people have a lot of barriers to being healthy. That could be some of those bigger systemic or social factors like racism, historical redlining, access to quality housing or education, and so on. These two pictures show how we can address some of those barriers through resources and services. So the picture on the left with the bikes shows that at the top, if we give everyone the same resources, it's not going to work for everybody. Not everybody was able to use those resources the same way to be healthy. So the bottom part of that picture shows if we give specific resources to meet people's needs, then they're able to adapt to those things and thrive. And then the bottom right picture also kind of shows that same thing where in the first part, it shows equality. We give everyone the same resources. It doesn't work for everybody. The person on the right can't see the soccer game. But the middle part shows equity. So if we distribute resources based on need, everyone can see in. And then the last part takes that one step further to show justice. That's just really getting to the root cause of those inequities and removing those barriers. So this just sort of illustrates that there's not a one size fits all solution or a program or policy to address health equity. We want to work to find services and resources that's going to give everyone a fair opportunity to be their healthiest selves. And this requires like a concerted effort to increase opportunities for everyone, especially those who have the most obstacles in their way. So this just talks through some of the health equity work we've done here at the Wauwatosa Health Department. We have a health equity webpage on our website that just gives kind of a brief overview of what health equity is, also includes our health equity mission statement. We do an annual Health Equity Awareness Week where we just push out information about health equity, highlight some of the things that we're working on. We also do that regularly through our social media, our website, and other communications. We make sure our staff is regularly trained in health equity and we continue to improve upon those things. We also use data analysis to identify health disparities in Wauwatosa. So for example, every 2 years we do a youth risk behavior survey with our high school students. And in 2019, we really looked at mental health outcomes and broke that down by LGBTQ youth and youth of color to see where those disparities are within our school system. We also have a strategic plan and a community health improvement plan, which incorporates health equity into our goals. We have staff who participate on the Wisconsin Public Health Association Racial Equity Committee and a Public Health Generalist Network Health Equity Subcommittee. Earlier this year, we were a part of the NACHO, which is the National Association of City and County Health Officials. They have a Strong Systems, Stronger Communities Equity Project. We were one of 7 projects chosen nationwide to be accepted. So our project focuses specifically on those mental health disparities among LGBTQ youth. So we started the project earlier this year. It's on hold right now because of our COVID response, but we hope to pick that up early next year. And it's really just looking at how we bring the community together with feedback from the community and those LGBTQ youth who are experiencing those mental health disparities so we can address those. And then finally, earlier this year, we worked with the Greenfield Health Department and 2 Masters in Public Health students from the UW School of Public Health to create a regional health equity toolkit. As a region, health departments kind of recognize that there's a gap between understanding what health equity is and actually integrating that into our work. So we created the toolkit sort of as a resource that provides ideas and tools to help local health departments integrate health equity into their work. We hope to adopt many of the pieces from this toolkit so we can improve the work within our own department and further our work in health equity in Wauwatosa. So some of our next steps, we want to continue building on our existing equity programs and make sure we continue to incorporate those pieces into all of our services. Also provide those ongoing trainings for staff on equities to make sure that they understand how they can incorporate equity into their daily work. We'll continue to push out education and awareness on our social media. Like I said, we hope to pick up the NATO project again early next year, implement pieces from that toolkit. And then a couple of new things. We really are focusing on a health in all policies approach. So we recognize that health is impacted by many things in our community, not just the direct services that we provide here as a health department. So how can we look at some of those bigger policies and how they might impact the health of our community? And then finally, next year, we are going to be doing our 2021 community health assessment. This is what guides our 5-year strategic plan and community health improvement plans for our department. And that process involves, talking to the community, gathering feedback, both qualitative and quantitative data. And so we really want to make sure we're using an equitable approach when we are moving through that process next year. So that's an overview of sort of our work in health equity. And I'm going to talk a little bit about COVID, just some of the data that we're seeing and some of the disparities in that data. So that didn't come through quite well, but just some overall statistics. These are already slightly dated even from a couple of days ago, but our total positive cases were just under 1,400. Of those, we've had 48 hospitalizations, 26 deaths. And I actually got the updated positivity rate today at 8.4%, and our case burden is 532. And so that just means the case burden per 100,000 population. It's a number you see that a lot of communities use just to measure the burden that COVID has on their community. So as you can see, we're unfortunately experiencing an increase in cases. The top right graph just shows cases by month. The bottom left graph shows the number of tests performed per day. So you can see we are experiencing an increase in testing. And then the bottom right graph shows our daily positivity rate. And so that's also on the rise. We use 7-day averages for those because it gives a more up-to-date number instead of, it can vary a lot day to day. So this just gives us a better depiction of what's actually happening in our community. So again, just some basic statistics are breakdown by gender, age, and race ethnicity. So you can see slightly more female than male cases. Our ages are predominantly in the younger age groups. That's changed a lot over the course of COVID. When this started, it was predominantly older adults, and now we're seeing more and more younger cases. And then you can see race ethnicity is majority white, but I'll compare these to our demographics here in Tosa on an upcoming slide. So again, just to break down deaths by age group, over half of our deaths have been individuals who are 90 years or above. And then deaths by race, again, 78% white, 13% Black, 4% Asian, and 4% Eastern Indian, which is just one death each. And again, our hospitalizations, predominantly older adults. However, hospitalizations, the way they're reported to us is anyone who is hospitalized who happens to have COVID, not necessarily hospitalized because of COVID. So those numbers do vary a little bit. A woman could be pregnant and having a baby and also test positive. But the deaths are attributed directly to COVID. So you can see here, we have some disparities in our COVID data. So the gray bars on the left are what our Tosa demographics look like. And then the red bars on the right are positive COVID-19 cases. So you can see there is a disparity for race and age. So when we look at cases by race, you can see there is, it doesn't quite line up with what our demographics look like, showing that disparity. And again, with the positive cases, and I broke these down into smaller categories or broader categories because it's easier to see. And then again, same disparities with deaths and hospitalizations where people of color are experiencing these cases, deaths and hospitalizations more than the white population in Wauwatosa. And again, older adults are experiencing more deaths and hospitalizations due to COVID. So just a couple reminders on how to protect yourself from COVID. Make sure you're wearing your mask over your nose and your mouth. Keep at least 6 feet of distance between yourself and others. wash your hands frequently, regularly clean those high touch surfaces, stay home when you're able, and then try to limit in-person contact with people outside your household. So we know there's unfortunately not one magical way to protect yourself from COVID, but doing all of these things together can really help, decrease your risk of transmission. And this is how you can find us, our website, and on social media.
Thank you. That was very informative. So I have several questions to ask before we open up to our audience.
Sounds good.
Just sort of clarifying questions. And well, I did want to ask you about flu shots. You didn't mention that. Is the health department providing flu shots this season?
We did one flu clinic earlier this month. Just because of our staff's response to COVID, we just don't have the capacity to do another one this year. It's unfortunate. I know it's a big need, and everyone should be getting the flu shot this year. So there's a lot of other good options. You know, your primary care provider or Walgreens and CVS are also good options.
Someone told me that Target is giving them.
Oh, yeah. Mm-hmm.
Yes.
Yeah.
And I know the COVID testing site on the north side, they were giving free flu shots too. For people.
Yeah, they were doing, I think, drive-through flu shots and testing.
Yes. So, okay. So I wanted to ask you about the YRBS, the Youth Risk and Behavior Survey. Mm-hmm. How does Wauwatosa compare to other suburbs? Do you do that comparison?
I think we get comparison to the state. I can't remember if we've received 2019 data. I think because of COVID, everything's sort of delayed. We got our local data, but I don't think we received the comparisons, or at least it's not been widely distributed yet.
Okay.
Typically, we're not very different from statewide data. We're lucky this past year, actually, we were able to survey all of our high school students at East and West before we had a smaller number of students participate. So this past year, we were able to get a little bit better data.
Okay. And then I wanted to ask about, you had mentioned once partnering with Greenfield. Do you in the health department partner with a medical complex at all?
Yeah, we definitely do. We were trying to work with a lot of community partners. With our community health improvement plan, we have 4 priority health areas, and each of those have sort of like a community coalition to go along with achieving those goals. So we have partners from the medical complex in those as well. Okay.
And then I'm not sure if I'm going to pronounce this well. Nacho. So you said you were 1 out of 7 health departments chosen. So what made you attractive, or what was it about your project that got you chosen?
That's a good question. Our health officer, who's also named Laura, wrote our application. But I think because we've been working on equity for a while, it was specifically meant to be an equity project, and they really helped us sort of like fine tune what we wanted to work on. We had a general idea that we wanted to do mental health. And I think because we had a lot of good data to bring to the table from the YRBS, that helped sort of hone our project.
Okay, thank you. Mm-hmm. And then you mentioned Health in All Policies initiative. Can you give me, or can you give us a specific example of what would fall under a Health in All Policies initiative?
Sure. So there are some communities, including Wauwatosa, that participate in like a Green Streets initiative, where you really look at the built environment and how that impacts the health of the community. So do your streets have bike lanes, or are there sidewalks where people can walk? Is there green space for people to get exercise? What does the lighting look like? Is there an adequate amount of street lights so that if somebody wants to walk outside at night, they feel safe doing so? Mm-hmm. So we would work with other departments on making sure that the developmental changes we do here in Wauwatosa are also supporting a healthy lifestyle.
That's really interesting. I'm on the sustainability committee, and I'm sure we would love to work with you on things like that.
Yeah, definitely.
Yes. So I will now open this up to our audience and let me look for some of our questions. So here's a question. What has been rewarding about having an equity week for the health department? It's in December, right? Or is it
Yep.
November? December.
Yeah, it's usually
Yeah.
December.
Okay. And are you planning to expand that? That's part of the same question. Yeah.
Yes, good question. This year, everything's a little bit up in the air because of COVID. So everything that we have normally done in past years has been on hold, except for sort of emergency situations or really high priority things, because all of our staff is just focused on COVID response. So at the very least, we'll hopefully put some stuff out on social media for Equity Awareness Week this year. But we do hope to expand that in future years. So to answer the most rewarding part, I think it's health equity is something that is sort of integral to all the work that we do here in the health department. And so we make sure that we're, our policies are equitable and the services we provide. And that's constantly an evolving process where we're improving on those things and reevaluating to make sure that we're meeting the needs of everyone in the community. So it's nice for us to be able to bring attention to what health equity really means. Like I said before, I think sometimes it's hard to make that connection between some of the like social or systemic factors that play into healthcare and so, or public health, and how we can do a better job of explaining some of that. And Health Equity Week allows us to kind of bring some attention to that. So it's nice to be able to start that conversation in the community and build on that. So yes, we do hope to expand on it, but it might have to wait till 2021.
Okay. And I do want to remind our Facebook audience that you can post your questions in the chat and they will be relayed to us. So please join in the conversation. So the next question I have is, what have you done to help our community learn more about the higher risk of COVID to people of color?
That's a good question. I think when we talk about anything in public health, we always try to look to what is the root cause of something. So whether that's obesity or, disparities in COVID data, we try to ask the question, like, why is this happening? So when we look at disparities in race for COVID, whether it's cases, hospitalizations, or deaths, we want to ask why that's happening. And I think it's the same, underlying factors of why we see disparities in a lot of health outcomes for people of color. So unfortunately, like I said, we're really wrapped up in COVID response. We're just trying to notify everybody that they're positive or they've been in contact with someone. But we have done some things on our social media to bring awareness to this issue. We send out a weekly email to over, I think, 500 people on the email list. We try to include things about equity and the disparities in COVID in that as well. Otherwise, we're just pushing out prevention messages to everybody in the community. I can't even remember what the original question was at this point.
It was, what have you done to help our community learn more about the higher risk of COVID to people of color?
Sure, yeah.
Okay. Another question for you is, have you been able to work with the Tosa schools to add equity and inclusion themes to the health curriculum that is taught? And maybe another question would be, are you familiar with the health curriculum that is taught? I don't know how much, overlap there is between you and the school district.
Sure. So some of our nurses may be a little more involved. I'm not too familiar with what their health curriculum looks like, although we have partnered with them on a number of other things. So, that's a great suggestion, looking at including equity into that curriculum. So that's something we can definitely explore in the future. But like I said, we have partnered with them on other things. They're a part of some of our community work groups. When we talk about our NACHO project, we have included them as a potential partner on that piece as well, so we can look at some of the mental health outcomes for our students.
Yeah. Laura Conklin, she came to, she has presented at when my children were at West to our PTA. She's presented twice. And then I think there was some representation at the district level on the wellness committee because I was on the wellness committee and there was representation there as well. So our next question is, why should everyone be concerned about health equity? I know you covered some of that in your presentation.
Yeah, that's a good question.
Yeah.
Well, I think, health is everything we have. So if we don't have our health, what do we have? So I think looking at a number of different things, when there's disparities in health outcomes, people aren't able to be their healthiest selves, and that can have an effect on the whole community. So, if someone is, for example, doesn't have a primary care doctor, they may, utilize the ER urgent care more often because they don't have that doctor or that healthcare center to go to. And so then that can be an undue burden on costs. So if they don't have insurance to cover that, or they're, constantly using a more high cost service when we're not looking at the prevention, that can affect the community. I'm trying to think of some other examples. And I think too, some of the things I talked about before, like having those pieces in your community that remove those barriers. So having access to healthy foods, feeling safe in your neighborhood, having access to good education and affordable housing, that's something that's important for the entire community. And so being able to recognize those things and where those might not be available to certain people, it's important to highlight that.
Okay. The next question seems pretty similar. How does health equity impact on other parts of our community? And I'm not sure, like, as a health department, is there a way that you observe that? Like, how would you observe that maybe there's some consequences of maybe health inequities on the west side as opposed to the east side, or on the north side as opposed to or around the Mayfair area? How would you collect that kind of information? Or
Sure. So we do a community health survey every couple of years, which gives us general data about Wauwatosa's health. That's on a lot of different factors: mental health, substance use, healthy eating, exercise, all of that. It doesn't break it down by area. However, we do look at other things by area. We've looked at like number of overdose deaths in specific areas, and do those are those consistent, or are they near areas where there's access to substance use treatment? So are there pockets where there's maybe not access to treatment and we're experiencing more overdoses in that area? Things like that we try to look at across our city. One of the things, again, we were hoping to do this summer, but with COVID we weren't able to, but looking at sort of like our alcohol culture here in Wauwatosa. And one of the things you can map out is like outlet density. So number of bars or restaurants in a certain area per population, also liquor stores, and sort of mapping out that across the city and looking at those effects. Historically, with, advertising around, tobacco and alcohol, those tend to be in lower income neighborhoods. And so that can, create that disparity even more for certain populations. And I think looking at Wauwatosa as a whole, we have pretty good health outcomes compared to some of our neighboring communities, especially when we look at, we're right next to the city of Milwaukee. It has some drastically different outcomes than we do. And what are the things that create better outcomes for us in Wauwatosa, and how can we partner with our surrounding communities to make sure that those services are available to everyone?
Okay. You mentioned mapping out certain areas. I think it was on Next Door Neighbor that some people were commenting that there's been an increase in rats. I don't know if you've had that several calls or not about that. It seemed to be somewhere on the east side that some neighborhood is having an uptick in rats.
We get calls about rats everywhere in Wauwatosa.
Okay.
Yeah, we have mapped it out, and it's from all over the place. Sometimes when there's like construction projects, it can cause just an increase in rat activity if their habitat is disrupted. We've done some things as a city to require baiting and trapping if there are construction projects going to happen.
Okay.
Hopefully,
all right.
It's not too bad, but
yeah. Okay. So the next question How have we, it's similar to another one. How have we particularly seen health equity, inequity demonstrated in COVID? Yeah, that it is similar to what but maybe you have something else to say?
Yeah, I think the graphs from Wauwatosa are, the differences are not drastic, but we do see that, people of color are disproportionately affected by COVID cases and hospitalizations and deaths. That's true for Milwaukee County. It's true across the country. So I guess, and there can be a number of things that cause this. Like I said before, there's a lot of those factors that are causing health disparities for people of color, like, so they might already have some of those underlying health conditions at a higher rate. So heart disease or obesity, that puts them at higher risk for COVID. Also, like we see, trying to think of other examples. So some of those disparities can come from, like, if somebody has to take public transportation or work a job where they're interacting with the public more often, those service jobs, they could be higher risk that way as well. So if that's, I'm trying to explain it well. There's a lot of pieces that come into play for why COVID is disproportionately affecting people of color.
And access to healthcare would be another one.
Yeah.
Maybe you could briefly explain how you get your data. Like, you're over there in City Hall. How do you even know that someone has COVID or their race? Maybe you could explain that real briefly.
Yep. So we use the database. It's called Wisconsin Electronic Disease Surveillance System. We call it WEDS. And all test results get uploaded into that system. So we see all positive and negative test results for COVID. This is something we use for all communicable diseases. So it's a system we've used in the past, but now we're using it for COVID a lot. A lot of us have had to learn how to use it recently. But it puts in basic demographic information. For some people, we get more than others, depending on what's collected at the testing site. And then we reach out to those individuals and we'll collect more information. So if certain demographic categories aren't filled in when we receive it, we'll do that in the interview with the person who's positive. So that's how we get data. It's limited. It's not always, fully filled out. And if we can't get a hold of somebody, some of that is left unknown too. So there are a lot of unknown in our race category because we don't have follow-up on those. So. Okay.
And then if you get information that someone has COVID, how do you know if they have a primary care physician? Like, do you call them and make sure that they're getting the help they need, or?
Yep. So we ask a lot of questions. Part of it is if they have a primary care doctor, if they talk to the primary care doctor, because a lot of people get tested at those community sites. So they're not even involving their primary care doctor in that process. But we make sure that they know what symptoms to look out for and when to reach out. So if they have a primary care doctor, we make sure that they know how to contact that person if something does happen. Obviously, if it's more severe symptoms, calling 911 or going to the emergency room, but making sure they have those resources if they do need it.
All right, great. The next question is, what are the most important things that we can do to improve health equity? And I know that would be the systemic.
Yes.
Yeah. Okay. Go ahead.
But I think it is, recognizing that there are those big systemic factors that influence equity. So there's a number of ways we can address those things as a community, as a health department, in our own individual workplaces, recognizing those things. As a health department, I mentioned we created that toolkit to help local health departments improve health equity. And so that includes a number of things like analyzing data, improving communications, hiring practices, everything, just to make sure we are integrating health equity into our work and promoting it throughout the community. But again, it goes back to those systemic things and making sure people have access to those resources they need and removing those barriers to their health. So That's quality housing, quality education, stable income, safe neighborhoods. It's all those big things.
Mhm. Does the city ask the health department for suggestions or advice about any of these issues? Because as you know, the city government, I think some of their policies would directly benefit from maybe input about these things.
Yeah, we have close relationships with other departments. So we're involved in some regular meetings. Our director is involved with the department director meetings where some of these things come up. But like I said, this is something we're constantly working on. So the toolkit we created has some tools for looking at your existing policies with a health equity lens. So that's something we plan to do here in the health department is as our policies come up for review, making sure we run them through these tools to make sure that they're including health equity and being equitable in what we're doing. And so that's something we could potentially look at as a city as well.
Mhm. How many people work in the health department?
We have about 15. We have a couple extra. We've hired 4 extra people to help with COVID response, but our normal staff is about 15.
Okay. And would you consider that you have a diverse staff in the health department?
We have some people of color, but it's something, again, that we strive to work on. So as we are improving our hiring practices and working with our HR department on ways we can improve that in the future. Like I mentioned, the toolkit has pieces for that. And I think we're learning that through some of the trainings that we're doing as a city as well on how we can do that better.
Mm-hmm. Do you have any males? Just curious.
2.
Okay. I think I've only seen females when I come down there.
Yes, there's a lot of females in our department.
How can health equity be best addressed in the schools is the next question.
It's a good question. I think it is, having that data is helpful to really identify some of those disparities, because I think a lot of it can be sort of anecdotal or, we think we're seeing this or we're hearing about this, but having that data from the students about what they're actually experiencing is really helpful. So like I mentioned before, we are seeing disparities in mental health outcomes for LGBTQ youth and youth of color. So I think identifying those, first of all, that those are existing in our schools, and then what can we do to improve upon that. So we partnered with the schools on some events in the past, and hopefully bringing some education to students, to faculty, to parents, to address some of those things.
And that's something that Tosa Together is very concerned with too. So if there are ways that we can partner with you, I've talked about that with Carmen. We're ready to do that. I wonder if not just maybe in your health department, but whatever coalitions or alliances of organizations of health departments that you are in touch with, if there has been much talk about the fallout or what the mental health challenges that will occur as a result of COVID, like, is there going to be a need for extra counseling in schools, or is there going to be, have to be some sort of shift in because children are going to, I don't know what you call it, but sort of like PTSD after this is all over?
Sure. I think that's definitely a concern. Just as a county, we're seeing higher rates of overdose deaths, suicides are increasing. So it's definitely taking a toll on the mental health of our community. When we look at schools, I know I sit on the medical advisory and public health committee for the school district to help determine what those metrics look like for recommending hybrid versus in-person versus virtual. And there are a lot of really great mental health professionals on that committee as well who are thinking about that now. So addressing student mental health, whether they're in the classroom or they're virtual, making sure that those things are, are trying to address those things as much as we can now, but definitely as we move through COVID and hopefully past it, what that looks like, and making sure that doesn't get left behind.
It seems like this is an opportunity for all hands on deck, as a community, if we can rally around each other, especially our retired folk. And, I think if maybe if the health department or the school district can, let people know their needs, um, then I think as a community, it would be a good thing for us to, to build back stronger, to be together in this. Yeah.
Yeah, definitely.
Um, sorry, there, let me see. Do you have the staff and technology you need for proper contact tracing? I don't understand the next one. It's like, do you hope that the pandemic will be over before that budget needs to be increased? The staff, I'm not quite sure what that.
Yeah, I can kind of answer that. So I guess the answer is no, we don't have enough resources, but that's true, I think, throughout our region and our state is as we're seeing this increase, it's harder and harder to do full follow-up. So the southeastern region of Milwaukee released a news release today saying that we are prioritizing certain populations when it comes to contact tracing and disease notification because we want to make sure those higher risk individuals are getting the education and the follow-up from us that they need. We are trying our best to get to everyone, but it's definitely a challenge. This is, it's hard to anticipate what's going to happen with COVID because it is new and we're sort of learning as we go. Fortunately, we've been able to hire some additional staff to help us out, and we're working through what that's going to look like into next year and potentially into 2022 as we have to continue to follow up on this. So it would be nice that the pandemic is over soon and we can get back to some of our normal work, but it's something that we're planning for as a state of how we're going to move forward and fund everything that we need to do to appropriately address responding to COVID-19.
Yeah. Once you're, I've forgotten how to say it again, Nacho. Once your NACHO study is done, what will the health department do with the results? Will the learning be shared with schools or the community?
Yeah, so the idea of that project is to really build like sustainable programming. And so not just, one and done focus group, but really taking feedback from the community, from LGBTQ students, mental health providers, working with the school district to figure out how we can address some of these disparities long term. So whether that's, part of the project is learning what those barriers are or what those root causes are of mental health issues in that population. So the point of the project was not for us to guess as a health department what we think those are and then make solutions, but to really get the feedback from the community and respond to that. So whether that's access to treatment, whether that's support in the schools, whether that's peer support in their community, figuring out where we can best create solutions and then build upon that to create sustainable change. So yes, we will definitely share as we move through that project what that looks like and what comes from that, and then hopefully continue that on.
Okay. So there are a lot of COVID questions.
Yeah, that's okay.
In the city of Milwaukee, Black people consist of half of COVID-19 cases, despite comprising of only 41% of the population. They are dying at a significantly higher disproportionate rate. Are there any partnership programs between the city of Wauwatosa and Milwaukee in regards to health or COVID impacts on Black residents? What can Wauwatosa residents do to assist our neighbors?
That's a good question. We work really closely with all the other health departments in our region on COVID response. So one of the things we look at is where testing is available. So making sure that those people who maybe don't have access to regular healthcare or primary care doctors have access to free low barrier testing. So that's one thing we do as a partnership with Milwaukee and other health departments is look at those pieces to make sure that that access is there. But testing is obviously just one piece of the COVID response, and trying to think of a good answer. I think as a whole, as a community, not just Wauwatosa, but as a county in a southeastern region, really making sure we're keeping ourselves and each other safe from COVID by, wearing a mask and distancing and not interacting with people outside your household. That will help reduce the COVID burden across the board, which will, benefit everyone. But it goes back to some of those systemic factors that are creating those disparities. And I'm not an expert in what Milwaukee Health Department is doing, but I know that they're working really hard on their response, and they've got some really good health centers throughout the city to assist with that. I know that was a multifaceted question, so I'm not sure I answered all those pieces.
Yeah, it's a complex problem.
Yes.
Yes. So the next question is, does the city look at the mental health impacts of racism? What are some of the ways the Wauwatosa Health Department is addressing this?
Sure. We haven't done specific research or data collection on Wauwatosa specifically, but it's definitely something that we're aware of. The Wisconsin Public Health Association, which we're a part of, did declare racism as a public health crisis, and that's something that we recognize as an issue in our community and throughout our nation. So it's something that we try to bring awareness to as we do community education. We have put things on our social media, just trying to bring attention to these issues. As we build on our health equity work, we want to lay that foundation of this is what health equity is, and these are some of the things that affect that, and then build on those pieces to really try to, start some change in those areas. It's complex, and these are some of the things we're seeing affecting the health of our community across the board.
So do the school nurses have anything to do with the health department? Like, do you interact with the school nurses at all?
Yeah, especially with COVID, we do a lot. So we do work really closely with them, and we have in the past too. A lot of that's been with, just communicable disease follow-up. Our nurses partner really closely with them.
Mm-hmm. I was just thinking of the fact that if racism is recognized as a public health issue and there are children, non-white children in the schools who are feeling the impact of that, is the health department or is the nurse an advocate for them as well?
Yeah, that's a good question. And there are mental health professionals in the schools too. But I do think there's room for improvement all across the board.
Oh, for sure. So this is a question about career. If a young person is interested in going into public health, what would you say to them about the work? And if you could also just include a distinction for some people about public health as opposed to the medical field. Yeah.
Sure.
Yeah.
So public health can be a lot of different things. Here at the health department, we do a number of different services. Some of it's direct service. We do, flu shots, immunizations. We do home visits for people, fall prevention for older adults, newborn screenings for all those new babies in Wauwatosa. We also do environmental health. So we have a team who does restaurant inspections and rabies exposures and rats. So there's a lot of different things that go into public health. So we do some of those, I consider it more like community health, community level health. So when you think about healthcare, it's more direct service with individuals about their individual health. And as a health department, we look more at the community health. So what can we do on a community level to make sure that our community is safe? So making sure our restaurants are safe to eat at, making sure our immunization levels are high so we can reduce communicable disease within our community. And then even looking at some of those bigger pieces like policies within our community to make sure we're creating a safe, healthy, and welcoming community for everybody.
Okay.
So I would recommend public health. I love it. I think I worked with Vivint Health before I came here, and that was with more direct patient care around HIV, hepatitis C, and substance use. And so it's really valuable and rewarding seeing individual behavior change and being able to work with individuals about improving their own health. But then you see that there's a lot of these systemic pieces that are impacting whether or not they can make those healthy choices. So do they have access to treatment? Are they able to, access healthcare? Are they able to make those healthy choices for themselves? And that's where we come in sort of as a health department to say, let's help you, reduce some of those barriers and make those healthy choices easier for you.
Okay. What would be the top 3 or 4 reasons a Tosa citizen would call the health department? Outside of COVID.
Sure.
Regular.
Yeah, I think I see it in sort of 2 pieces. We have our nursing division, which handles all of our communicable disease and immunizations. And so we will get a lot of calls about, if a kid needs certain immunizations for school, we can help provide those, especially for people who are under or uninsured. And then we have our environmental health side where we do get a lot of calls about rats. So I don't recommend calling us because right now we're only doing COVID, but I think it's, let's see, what is the top 3 or 4 reasons why someone would call? So I would say, these are kind of broad, but like your individual health, if you need help accessing services to get immunizations, find a primary care provider, find healthcare resources in our community, we can help with that. Your home health, so we do radon and lead, screenings for people in their homes. Especially if a kid comes back with a high blood lead level, we can do screenings or assessments in their home to find out where that's coming from. So individual health, home health, and then I'm trying to think. I guess it comes back to those community level things. So we do work a lot with our partners on some of those bigger issues, and we do get calls about those things too. So
Okay.
we provide a lot of resources. I haven't done a lot of those in about 8 months because of COVID, so it's hard to remember all of them.
Yeah. So where can Tosa residents find more information about the health department?
Yep, our website is wawatosa.net/health. We're also on Facebook, Instagram, and Twitter. So that's where we post a lot of our updates. So all of our data updates are on COVID, updates on our COVID response, and then trying to sneak in some other things here and there too that aren't COVID related because those things are still really important. But our website has all of our information.
Okay. And this can be our last question. What would be your or your department's first priority once COVID is over? What would you like to see done, or what would the department like to see done? Like your first priority?
That's a good question. I guess health equity is such a big piece of what we do and how we want to see our community, progressing through COVID and everything else that it faces. So making sure that we as a city are including equity in the work that we do. So, a big thing is just getting back to our normal workloads and making sure that we can respond to these big issues that are still big issues, even though COVID is happening. So substance use and mental health and other communicable diseases that are out there that aren't being, fully addressed because of our COVID response. But making sure that equity is infused into all of that, and that's not getting overlooked, because I think sometimes, there are competing priorities, and we can't forget about those important underlying factors.
Okay, thank you.
Yeah.
Are there any closing words you would like to say before I close this out?
No, I appreciate the time to talk about it. I only talk about COVID now, so it's nice to talk about a couple other things for once. So I definitely appreciate it.
Okay, well, thank you.
Thank
Please
you.
join me, audience, in thanking Laura Stevens from the Health Department for joining us tonight. We really appreciate her coming to share information and experience with us. Thank you, Laura. And thanks also to you, our Facebook audience, for your time, as well as for your comments and engaging questions. We hope you found this presentation enlightening and inspiring. And a special thank you to our generous friends at Bostic, whose support makes the Tosa Talks series possible. Plan on joining Tosa Talks for 3 November discussions around the theme of local business development, growth, and community impact through a racial and social justice lens. Reach out to Tosa Together anytime through our Facebook page, our website, or by emailing us at tosatogether@gmail.com. This is Catherine Reeby from Tosa Together, and it has been my pleasure to be here with Laura Stevens of the Wauwatosa Health Department, as well as with all of you tonight. Thanks again for being part of Tosa Talks and our mutual effort to build a diverse, thriving community. Good night.